Well, first of all, thank you for coming. I know we're competing with other newsworthy items today, and hopefully more members of the press will come in as the speakers in the Pro Tem's press conference ends. I'm anxious to find out how well they did in Washington as well. Hopefully they came back with $20 billion for all of our sakes. Today we're here to talk about a very important bill, in my view, in this session, perhaps one of the most important. That's SB 1071. I am very grateful for Bob Pack, a constituent who you'll hear from shortly, for his tenacity and his passion, understandable given the circumstances that brings him here into this issue. For me, it has been an amazing learning process just in this short period of time to discover what a problem prescription drugs have become for all their benefits to Californians and to Americans, indeed the world. In the American pharmaceutical industry, there are some downsides and there's some very definite dark sides and costs to Californians. We have seen a 97% increase in prescription narcotics deaths in this state. 6.9 million Americans abuse prescription drugs. 4.7 million people have used various prescription drug pain relievers, sedatives, and stimulants non-medically for the first time in 2008. Drug overdoses are the second leading cause of unintentional death and have doubled between 1999 and 2005. The cost of prescription narcotic painkiller abuse was $8.6 billion in 2001 in the United States. Direct health care costs alone were $2.6 billion. By 2007, more teenagers used prescription narcotic painkillers recreationally than used marijuana. Non-medical use of pharmaceuticals have accounted for more than 500,000 emergency rooms in California. And this is an environment where the pharmaceutical industry has done wonderful things, but they've also had amazing profitability. Forbes magazine of the Fortune 100, we have found through Forbes that profitability as a percentage amongst industries in the United States is highest in the pharmaceutical industry for 3 decades consistently. We are one of only 2 countries in the world that allows for advertising for prescription drugs, New Zealand being the other one. We're the only country in the world that doesn't have some kind of cost control on prescription drugs. And this is not to blame the pharmaceutical industry. It's to illustrate that there has been growth in their profitability and their product being the marketplace at the same time of very aggressive marketing. And because of that, we think it's not unreasonable to ask that we guesstimate that there's $30 billion worth of revenue in California alone in the pharmaceutical industry that they pay for $5 million to help to create a sustainable funding source so that those people who are abusing the system, for doctors who give prescriptions knowingly to people who should not be prescribed prescription drugs and then go out and abuse them and add to these costs, to clients who go around and shop for doctors, and the doctors don't know because the information isn't available in real and necessary time to realize that these clients are doing this and are abusing the system. There's a simple way to cure that, and Bob will talk about it. Literally, it's a cure system that's already in place but needs about $5 million, according to the Department of Justice, for 3 basic components. The biggest and most important is to bring to scale the technology so that we can move from 2,300 prescribers in the database that use it right now and registered to 180,000. In order to do that, even if we mandated it, we couldn't do it now because the software system won't allow for that. So we need this money, most importantly, for that. Secondarily, for education, and last, for the Department of Justice to increase 2 new specific strike teams, one for Northern California and one for Southern California, to actually try to make sure that not only when we find out this information, but that the people who abuse the system are held accountable so that the stories you are about to hear about will not happen again in the future. It is a complex bill, and you will hear that in Senate Health Committee today. Today, the purpose is to get it through health based on the health parameters, but we will be more than happy to talk about the complexities of the funding mechanism. More importantly for that, I think, is next week after we get out of health today at the Rev and Tax Committee, and then on to the floor after we get out of appropriations. We have an amazing lineup today, and I want to thank all of them. For some of them, this has been an amazing personal journey, and you will hear those personal stories. And I'd like to start with Bob Pack. Mr. Pack is the founder of the Troy and Elena Pack Foundation. The foundation works in memory of his 2 children, Troy and Elena. They were 10 and 7. when they were killed in 2003 by a hit-and-run driver who was under the influence of prescription narcotics and alcohol. He has co-sponsored several California state bills, I should say, on DUI penalties and safety and the implementation of real-time cures program. He has chaired the committee for the cures program for the past 4 years and is sponsored, and I'm very proud to have him as a sponsor, of SB 1071 for the funding, sustainable funding of the cures program. Bob.
Good morning. My name is Bob Pack, and I'm the founder of the Troy and Alana Pack Foundation in Danville, California. It's named in memory of my two children, who the Senator, DeSaulnier, I want to thank very much for spearheading this really necessary Senate bill. And I want to thank all of the people here that are in support, some of them from various aspects of their industries, and some of them who have tragic stories of their own that are very compelling of why this bill needs to go forward. In 2003, a woman driving through my town passed out at the wheel and drove off the road at 45 miles an hour, running over my wife and two children as they were out for a Sunday afternoon walk to get an ice cream. My two children were killed and my wife did survive. Since then, I learned that the woman driving the car had been abusing prescription narcotics, and she was the ultimate doctor shopper. She had received 350 Vicodin pills in the 2 weeks prior to the accident and had taken them all. And she'd received thousands of narcotic pills from many different doctors throughout our community. In the 2 weeks prior to the accident, those 350 Vicodin pills were prescribed by 6 different doctors, all working at the same hospital. Yet, when interviewed by police, all 6 doctors said, "I didn't know the other one was prescribing." So therein lies the problem. Since then, I've spearheaded a committee and chaired the committee for bring about what's called the Real-Time Cures Project. And the Cures database in Sacramento, run by the Department of Justice, is a database that collects patients' activity reports, which is a patient history on every narcotic prescription, Schedule 2, 3, and 4s, distributed or sold in California. This information on a patient's prescription of narcotics is reported into this Cures database by law within 7 days after it's prescribed. And it's the pharmacist's responsibility to enter it into the Cures database and get it as part of this history tracking mechanism. That current database will house 150 million prescriptions by the end of 2010. It's a vast amount. It's the nation's most comprehensive database in the country. Now, the real-time aspect of the Cures database impacted me personally because the doctors and pharmacists need to have instant access to that information. Without it, you're really not utilizing this gold mine of information. And the doctor and pharmacist cannot make an informed decision whether to give a patient the needed narcotics or opioids, pain medication that they may need, or they need to be able to determine, is that patient an abuser? Are they a doctor shopper? Are they addicted? And we need to help them. And that's a decision that can only be made by the doctor and at the last line of defense by the pharmacist before they fill the prescription. The Real-Time Cures Project will give them the instant access to the database of information so they can make the proper informed decision. This bill 1071 is about funding this project, funding it long term. There are not enough resources either through the federal government or in California to allow this project to move forward in a terrific way. The project was launched in October of 2005 by Attorney General Jerry Brown, and it's up in a limited way. But as the Senator spoke, we have a large amount of doctors and pharmacists who need access to this, and we need to scale it, and we need the education program, and that's why this is so critical. Last year, 3,500 Californians died from prescription overdoses. From 2001 to 2009, the population of our state grew from 34 million to 38 million people, but in the same period, the number of narcotic pills prescribed in California in 2001 was 250 million, and in 2009 it was 2 billion. That's a staggering amount of narcotics being distributed out in our society. We need the drug manufacturers' support. The GAO, General Accounting Office in Congress last year reported that the economic impact on California was $5 billion due to prescription drug narcotics. That's a huge negative economic impact on California that we really can't bear, particularly at these tough economic times. And that number is growing. If we don't do anything and not pass this bill, that number will go to $6 billion and $8 billion and $10 billion. And California will continue to bear the strong economic burden that this carries. In the same time, the drug manufacturers off fraudulent prescriptions and abuse are gaining $200 to $300 million in profits. So you have this great inequity. The cost burden on California continues, and the profits for the drug manufacturer continue to go up. We need to balance that equity in a more fair manner and protect Californians. And ultimately, even though we talk about money and the need for money and the protection of money for various entities that have their own self-interest, this really is about saving lives. 3,500 Californians losing their lives in a way that we can drastically cut into that number. So I'm hopeful that we can get this legislation through and save lives in California. Unlike my two children, Troy and Alana, 10 and 7 years old, who weren't even abusing the drugs, but lost their lives. Thank you very much.
Thank you very much for the opportunity to speak today. I am a physician. I am a certified addictionologist. Also, I am a chronic pain doctor. So I work at the intersection between where these drugs are used and where they're abused. We have a very active, comprehensive treatment program in San Ramon. And I can say from personal knowledge that prescription drug abuse is an epidemic of just critical nature in our society. And I think it's all over. I can speak for our local area, of course. About 3/4 of the patients that we're seeing coming in now, I'm talking about high school students, young adults, are from prescription drugs. A couple of thoughts I have on that is that I know that when I prescribe these drugs, that these drugs cost $2, $3, $4, $5 a pill. What we're talking about with this bill is, I think, 1/4 cent a pill fee towards trying to eliminate this problem or battling this problem. About the cures, I want to speak just about how I use it. So this is a very practical thing. I want everybody to understand how important it is and how it's actually used. For many years in California, I could send a fax to a state office here in Sacramento, and 1 or 2 weeks later, probably I'd get something which would list all the prescriptions of Schedules 2 and 3. Those are the big narcotic prescriptions, including the drugs that April talked about. That's not fast enough. I mean, it was very frustrating. Now, with this new system, I go into my office, or one of the staff members, type in a name, birth date, get a readout, and I have the thing within 5 minutes. The first week that I had it, I had 2 patients where it was critical to my care of those people. The first was a young couple with a little baby who came in somewhere from the Central Valley with chronic pain problems and kind of a iffy story, and they wanted ridiculous doses of OxyContin, which, of course, being a chronic pain doctor, addictionologist, set off alarm bells anyway. But I was able to show that they'd been doctor shopping and had thousands of pills in the last month before that. I mean, that was a pretty good thing for me to see. We actually notified the police about them. The second was a young man who came in with a more reasonable story. He'd seen several doctors in the area, had some kind of a pain medicine problem maybe, but he really had a pain problem, he said. And I was able to determine at that time that he'd gotten like 60 or 80 OxyContin 80 milligram pills within a week of seeing me, totally at variance with what he told me. He was taking 2 or 3 a day. And I was able to accost him with that. And what I told him was, I will not treat you for pain. You don't have a pain problem, you have an addiction problem. And he was able to actually see that, and hopefully he's in treatment at this point. So those are 2 sort of different sides of the same story. The doctors that saw Bob's, the person who killed Bob's children, should have that. Most doctors don't even know it exists. It's kind of hard to get on the system. Once you're on it, it's really great. So we need this bill. We really need to have this bill, not only for just doing the system, making the system better, which of course would be really good. But we need it to, in order to get the word out to doctors that they have to do this. It should be the standard of care before prescribing narcotics that you get this kind of information, just like you get the patient's blood pressure or their temperature. It isn't. The last point I want to make is that where addiction starts. I have a unique sense of where that is because I see all these people. And where it starts is sometimes, best friend, quote unquote, gives them these drugs at school. And a lot of times in the parents' medicine cabinet, so we tell them to lock them up. And a lot of times it's the doctor themselves that prescribes this medicine to somebody for a legitimate medical purpose. It's their family doctor, orthopedic surgeon, broken leg, pick whatever it is. And people with the right genetic predisposition are off and running, and they can't get off. And that's where this thing starts. So we have to really, really work hard on educating doctors as well as the community, the extent of this problem. Drug abuse is almost $400 billion a year drag on the economy in the United States. That's a lot of money, even by government standards, right? It's a huge amount of money. So I can't urge you enough in the state legislature to please pass this bill and don't dicker around about a quarter of a cent a pill. Thank you very much.
The problem with prescription drugs in all of our communities across the state has just really burgeoned over the last several years. And I know that the board and members of the California police chiefs deal with this every day within their communities. In communities close by like ours in Rockland, we see the effects of prescription drug abuse in our moms and dads in the community, but also in our kids. And the high school age use of prescription drugs, largely because they're easy to obtain, is really taking off, and we are afraid of what could happen in the future. This is a very common sense bill, and I thank the senator for introducing this, and I believe that if we can get this passed, it's a good step in the right direction to slow down the drug abuse in our communities from prescription drugs. Thank you very much.
Ron, I want to thank again everybody who's here. And I also want to say that after the hearing, as many of these folks who have testified today will be available, and I know that other members of the press who weren't able to be with us because of other conflicts will be available after the hearing. And we'll be happy to answer any questions, but I do want to just conclude with on what John said and the need to tell these stories in this building, that we as a culture, in my belief, and since I've carried a number of bills that are been around the field of addiction and education, it's very clear to me that we are, in a very large sense, in denial in California and America about the challenges we have. And as you've heard, the first step in recovery, just as it is for an individual, as we've heard from individuals here, or an individual here, a brave individual, it's true for a culture or state as well, is to accept that we have a problem and to do that without stigmatizing anyone or ourselves and start to addressing that problem, which is the very nature of what this bill is for the pharmaceutical companies to partner with us to help to mitigate a consequence of their success. And we're looking forward to that discussion. We will hear some of their beliefs on this bill during the hearing and the testimony, but we're really hoping that they will come with us rather than to fight us, because we are going to continue to be tenacious, and in the hopefully 7 years I have left in the Senate, irregardless of what happens today, I intend to keep bringing this bill up every year that I'm here. I'm hoping that it will be passed and signed this year.